If your discharge is white or a transparent, whether it's less or more is pretty normal. So by 15 years, you should have at least one visit to a gynecologist who has a family history of a breast cancer. Their mother, their sister or their cousins, they should get this themselves checked. Even wearing a bra doesn't cause cancer.
Yeah.
There's a lot of myth going on.
Hello everyone, this is Resham from IHW Council back with another health talk. And today we have been joined by our country's top-notch gynecologist, Dr. Anjila Aneja. Firstly, thank you so much, doctor, for being a part of this segment.
My pleasure.
So, before commencing with the particular segment, I would just like to tell my viewers that आज का particular segment is not just restricted to women's health, but we would be going deeper into it. So, I think before further ado, let's just jump into the segment. So, ma'am, firstly, the first thing that I would also like to personally ask you is that when is the right time to visit a gynecologist?
One should visit as a teenager to a gynae. So by 15 years, you should have at least one visit to a gynecologist to know about yourself, to know about your periods, how to take care of yourself, and what are the challenges you face with your periods. And this is the time to discuss even about your sexual health and a contraception for the future.
Okay. So, sometimes when we've reached that age, we've started with the menstruation process, people are just avoiding going to the gynecologist. So, why do you think, what is the reason behind it? And, should we go on a monthly basis, get a, routine checkup done? What do you have to recommend about that?
Menstrual health is always a taboo in our country. So, everybody is doing a lot of work on it now. So, even there is no need to be scared about anything. It's very important that once you start with your periods or before your periods, you must go to a doctor and see how to go about it, how to take care of yourself, how often you should use your pads, whether you should use menstrual cups or tampons or not. So these are little things. So it's not that you need to come, every month to a gynecologist. One visit is enough, and she will talk to you about your diet also, your exercise, your menstrual health, and then if need be, you can go and meet her if there is any problem afterwards. And this is a time when we look into your vaccination details also. Okay. Like you must have heard about cervical cancer Mukt Bharat. Mm-hmm. And this is a very good time. The government of India is taking an initiative between 9 to 14 years to immunize all the girls for cervical cancer vaccination. Yeah. So all these things can be taken care at this time.
Okay. Yeah. So, what are the other tests that we can get done to know if we have cervical cancer? What is the process of that?
As per Indian guidelines, we do cervical cancer screening from age of 30. So, we do either a pap smear, which is a liquid base, or a conventional pap smear. And along with that, we do an HPV testing. Mm-hmm. So, once your pap smear or HPV testing is negative, one repeats every 5 years. Till the age of 65, unless a woman has some immunocompromised condition like they have an HIV or they have some transplant, they are immunosuppressive drugs. Okay. So these are the guidelines made by the government of India. And HPV vaccination can be taken from age of 9 to age of 45. And the young girls from 9 to 15, only one dose is more than enough.
Okay.
Yeah.
So, we've just talked about cervical cancer. What is the procedure for breast cancer? What are the kind of tests and vaccination, if you could tell our audience about it?
One, there is no vaccination for a breast cancer. But yes, the self-examination of the breast should be done 4 to 5 days after the periods is over. That you can do it yourself. Mm-hmm. First, look at the mirror, just bend a little and see how your breasts look like. And one is always bigger than the other one. And then you check your breast either in a circular manner. The breast should be, for example, the right breast should be examined with the left hand or vice versa. Either you see it a circular manner, and from your collarbones till the lower part, to the middle part of your chest, to the underarms. Okay. And you see for any kind of a lump. And this you can do it in shower also or while lying down also. Okay. And once in a year, if you want, you can go to your doctor and get it checked from the doctor.
Okay.
Yeah. And then comes the screening. Screening comes for like a mammogram. Mammography should be done from age of 40 at least once every 2 years, and from 50 every year. a woman who has a family history of a breast cancer, they should start 10 years before when their family member had a cancer, or who has taken a chemotherapy or a radiotherapy for the chest. So who has a family history of a breast cancer, their mother, their sister, or the cousins, they should get themselves checked earlier to 40 years.
Okay. Yeah. With that, switching our segment a bit about vaginal health, ma'am, does shaving or waxing pubic hair might be an STI risk?
Waxing and shaving, as per se, cannot cause STI. Okay. But if there is a cut, which is very common, yes, then the blood transmitted infection like HIV, hepatitis B are more. Even herpes can happen. Okay. That's the reason we say you trim or do a laser rather than waxing or and doing the razor of the pubic hair. Another thing, it's very important to understand these hairs are made to protect you basically. Yeah. They act as a barrier. So they prevent you infection to reach to the skin, which is very gentle.
Yeah. So ma'am, with that, just like we mentioned about STIs, what exactly is STIs and how can we prevent it?
STIs are the sexually transmitted infections, and they can happen after a vaginal, anal, or even an oral sex. And they can be of different types, like a virus type, like HIV, human papilloma virus, which causes a cervical cancer, and herpes, hepatitis B. It can be other bacterial like syphilis, chlamydia, trichomonas. So these are STDs which affects a woman's health. It affects her fertility for the future also.
Okay.
Yeah.
So ma'am, talking about birth control pills, are they actually safe? And can you just suggest some other options as well?
Birth control pills are definitely safe. They are not, there are few patients in which it should not be given. But the most important thing is, don't take it yourself. Just go to your doctor, talk to her. She will take your complete history and will advise you safely and get you into her follow-up checkups also. There are different kinds of birth control pills are available with us. We have very low dose ones, which are very good. They are good for even your skin and your hair, and you get your periods on a regular basis. Periods becomes less, your hemoglobin improves, your general health improves. But yes, in few patients we don't give it. We have implants available with us. If you don't want to take pills, we have intrauterine contraceptive devices like copper T or even Marina. But young people, if you are into a sexual relationship, we always tell you to use birth control pills along with use condoms, because condoms helps you to prevent from STIs.
Yeah. So ma'am, but with that, there's always a discussion that contraceptive pills can lead to heart disease or lung disease. So is that true?
No, that's not true. It's not a heart disease. We say if you take there are many good advantages of taking birth control pills. Yes, everything comes with some kind of a side effects also. But these are very rare side effects. For example, breast cancer. If you take it for more than 10 years, then yes, there's a slight increase in the risk of the breast cancer. But once you stop it, your breast cancer risk becomes normal as like any other woman. Yeah. Secondly, there's a risk of clotting in your legs, but that's now 1 in 30,000, Yeah. So they're very less. So to have an STI and to have an unprotected, unplanned pregnancy, I must say, have more side effects than taking a birth control pills.
Okay. With that, again, shifting our topic to vaginal health. So, what exactly, vaginal discharge, what does it indicate? And is it normal? And when is the right time to visit a doctor?
Yeah. Vaginal discharge is very, very normal. And it's a part of a woman's health. And if your discharge is white or a transparent, doesn't give you a smell, whether it's less or more, is pretty normal. One, it protects your vagina from any kind of an infection. It provides a lubrication. So it's very important to have it. And during the middle of the cycle, this becomes transparent like egg white, and it becomes very thin and it's more. This is a time for ovulation. And the woman who wants to plan a baby should plan at that time. But yes, if your discharge is too bad, it's too smelly, it's curdy, it's yellowish, green in color, and you have an itching with that, or you have painful sex because of that, then these are the time you must visit to a doctor.
Okay.
Otherwise, normal discharge, white in color, no smell, no itch, is perfectly normal.
Okay. With that, there's always a discussion going on from a lot of like years that if you don't wear a bra, you can get cancer. True or false?
No, it's false.
Yeah. Yeah.
Even wearing a bra doesn't cause cancer.
Yeah.
There's a lot of myth going on. If you wear a wired bra, it causes a cancer. No.
Okay.
No.
With that, doctor, conceiving at an older age, what's your take on that?
Nowadays, the women, they are very career oriented. They are getting married late. They are planning late babies. You can have pregnancy, even late in pregnancy, but later in your life. But the problem is this comes with few side effects also. Like there's a chances of difficulty in becoming pregnant. There are more chances of chromosomal abnormalities, more chances of miscarriages, and there's always a higher chances of getting diabetes and hypertension in pregnancy. So these risks are there, but we can't say you can't have a baby.
Yeah.
But definitely, yes, it comes into a little high risk category. You need more frequent visit to a hospital, more checkups, more tests, and more ultrasounds.
Okay.
But yes, we can have a baby.
Okay. So what about, like, there are a lot of women and males as well who experience extreme pain during sexual intercourse. So what can be the possible reasons for that?
There are many reasons that you can have a pain during sex, and many people are even not aware of it. So it's very important to take a detailed history of a patient and do a very gentle and a private examination. Sometimes you can come out with a history of a domestic violence and even a sexual abuse in the past. So that can be the reason. Sometimes there is a vaginal dryness, which can be because of the menopause, or there is a lack of desire in sex, or sometimes a woman had a surgery where the vagina length is less, or she has received radiotherapy of the vagina, where then you can have pain. Many times the STIs can also lead to painful sex. So after a complete evaluation and examination, one can find out a reason and can help a woman accordingly.
Okay.
Yeah.
So doctor, with that, how does the female body change after sex? Like, does it actually change or not?
Means if you look into it, after the first time, you can have a bleeding, you can have a pain, you can have a, pain while passing urine, there can be a discharge. Yes, the elasticity definitely increases. There's all after an intercourse and your discharge increasing, you can have an itching. So not anything more than that.
Like no physical changes or anything?
No.
Okay. So, doctor, what are the most common sex-related problems that women face and your patients come up with?
They come up with a lack of desire in sex, which we have already said earlier. It can be because they are not happy in the marriage. There can be some domestic violence or some sexual abuse in the past, or there are some kind of infections over there, or the woman, there is a orgasm problems. They are not, which is also very common. Or sometimes there's a difficulty in arousal. So these are the main sexual problems a woman come across.
Okay.
Yeah.
With that, lastly, doctor, is masturbation healthy in both women and males?
I will say masturbation is definitely healthy mentally as well as physically. One, with that, the good hormones are released and you feel happy about it. And the best is this is safe because you don't get pregnant or get STIs. So yes, masturbation is definitely healthy.
Okay. And with that, we'll just end our session with just the last question, that what are the most number of problems that you face, like the patients are going through, like the maximum number of the problems that come to you, like as a gynecologist?
The young girls, they come to us with lot of issues like their period issues and, their body images, like because of the sedentary lifestyles, they are gaining weight, acne, which is anyway very problem in young women, young girls. Polycystic ovarian syndrome has gone rampant because of that. Irregular periods are very common in first 2 months because it takes time for a period to settle down. Or heavy irregular bleedings, fibroids are very common. Endometriosis has gone up. Because of that, painful periods, painful sex.
Okay.
And definitely the postmenopausal women, the one who are entering into the menopause or before they have mood swings, hot flashes, dryness of vagina. Yes, these kind of issues usually a woman comes. But we always take an advantage whenever they come in. We talk to them about their menstrual health, sexual health, contraception. We take the pap smears also, do the breast screening as and when required, and help them out with an HPV vaccine.
So do you think that women are more opening up now when compared to 5 years back?
Absolutely. Absolutely.
Okay.
Yeah.
So I think thank you so much, Dr. Anjila, for being a part of this segment. I am sure our viewers are going to gain a lot from this segment. So thank you so much, Doctor.
Thank you. Thank you, Resham. Thank you so much. And my last thing is, don't hesitate to visit your gynecologist and don't get afraid. We are there and we are confidential about you.
So to all the women and men out there, please listen to this.
Thank you.
Thank you, Doctor.
Thank you.